Babies cry, that's how they communicate. But if your baby cries more than 3 hours in a day and it's a non-stop crying and it is happening more often at the same time around in the evening or at the night time, you have tried everything to calm down your baby but nothing is working out, that intense crying making you feel guilty, then you definitely need support. It means colic pain is affecting your baby. The most common reason is related to swallowing air at the time of nursing or if your baby is on bottle feed. If your baby is swallowing air, it can create severe abdominal pain and then it turns into colic pain. If your baby is facing acid reflux more often, it means your baby is throwing up after having milk. Your baby can have milk protein intolerance and that can lead to colic pain. Your baby's digestive system is still in the developing phase. It is not developed properly, then your baby can have colic pain more often. There are few symptoms through which you can recognize that your baby has intense colic pain. Your baby curls up the legs over the tummy. When you try to calm down your baby, he doesn't feel comfortable at all. Your baby's face can turn into red color because of intense and long-term crying. While intense crying, you will notice that your baby has clenched fists. If your baby is facing constipation, then your baby can be in colic pain. You will notice that your baby will pass gas frequently. It means colic pain is on peak. When you will lift your baby to calm down, you will notice that your baby will lean towards the opposite side. It means your baby is not comfortable at all. When you will touch your baby's stomach, you will find that it is pretty hard and swollen. That's a sign of colic. So what you can do to prevent your baby from having colic pain? When your baby starts crying, never shake your baby. It can cause brain damage. As a breastfeeding mother, you will pass on everything to your baby. So whatever you are eating, please take care of that and stay away those kind of foods which can create allergy and gas to you. Eventually it is going to pass on your baby. If you are changing baby's formula, then please talk to baby's pediatrician first. Your baby can be sensitive to certain proteins in the formula. Try to feed smaller meals more often. It will easy for your baby to digest. Burping is really important after every meal, but sometimes you will notice that your baby will not burp. At that time you can just gently rub your baby's back. It will help your babies to feel comfortable. You can also introduce colic drops. It will really calm down your baby. You can also walk your baby in the stroller and he or she will distract at that time. It will really help to calm down the cranky baby. At the time of breastfeeding, your latching should be perfect and make sure that baby is drinking milk and not swallowing air at that time. If your baby accepts pacifier, then you can also give pacifier for some period of time. You can call baby's pediatrician if you feel that due to colic pain your baby has fever, if he or she has diarrhea or he is throwing up, especially in green color. That's a warning sign, so please talk to your pediatrician as soon as possible. I hope this information is helpful for you to understand the causes, symptoms and treatment of the colic pain. If you really like this information, then please take a moment to subscribe my channel. I will see you in my next video.